Hello everyone, I'm Dr. Vicky Cleak and I'm a consultant psychiatrist and ADHD specialist, and today I want to talk to you about a really common worry that many adults with ADHD have when they're thinking about starting medication for ADHD. The question I often hear is, do stimulant medications damage the brain? Well, it is completely understandable to be cautious about taking something that affects your brain chemistry, as well as one which is termed a controlled drug. So let's take a calm, evidence-based look at what the research actually tells us, and I'll share why, far from being harmful, stimulant medication may actually save lives and have a protective effect on the ADHD brain. When I talk to adults who are hesitant to try stimulant medication, the fear often comes from the idea that those medications are strong or that they somehow cause harm to the brain over time. It's very easy to see why. Words like amphetamine or stimulant sound very intense, and we also hear about illegal drugs like methamphetamine or cocaine, which absolutely can cause harm. But the key thing is to understand this. Therapeutic stimulants for ADHD are not the same as street drugs in either their chemical structure or the dosage or how they're taken, and those things make a big difference. Prescription stimulants are designed to work gently in a controlled way to help restore the balance to the ADHD brain and not to overwhelm it. This is also why we titrate medication under careful supervision when we start anyone on these drugs. Over the past couple of decades, there have been numerous brain imaging studies looking at what actually happens to the brain in people who take stimulant medication for ADHD. And the findings are very clear. There is no evidence that prescribed stimulants cause brain damage, either in the short term or in the long term, because these medications have been around for a long time, since around the 50s. In fact, the opposite appears to be true. One large review of brain imaging studies found that people with ADHD who had been treated with stimulants actually had brains that looked more like those without ADHD compared to those who had never received medication. And the authors concluded that there was no sign of harm from treatment, and that stimulant use might actually help normalise some of the brain differences associated with ADHD. So in simple terms, medication doesn't damage the ADHD brain, it helps it function more like a neurotypical brain. So why do people still believe stimulants might cause damage? Well, a lot of that fear actually comes from original animal studies, especially those involving rats. In some of these studies, animals were given extremely high doses of stimulants, far beyond what humans would ever take, and often through injection or other routes that tend to flood the brain with neurotransmitters, rather than as we take it now orally. Under those conditions, yes, researchers did see signs of brain damage, but it kind of wasn't surprising. They'd given far, far, far too much. But when the doses were adjusted to reflect therapeutic levels, the ones we give to humans and the way we prescribe medication, and when given orally, researchers did not see any damage. So it's a bit like comparing having 1 or 2 cups of coffee a day to drinking 50 espressos injected straight into your bloodstream. The effects are completely different. So those scary headlines don't apply to real-world ADHD treatment. It's also really important to separate illicit stimulant use, like using methamphetamines or cocaine bought on the street, from that of prescribed medication. Street drugs cause large, fast surges of dopamine, norepinephrine, noradrenaline, and serotonin, flooding the brain's reward system and leading to depletion, tolerance, and damage over time. Prescription stimulants, on the other hand, release those neurotransmitters slowly and steadily within normal physiological limits. So while the names might sound similar, their effects on the brain are entirely different. Now here's something that surprises a lot of people. There's actually evidence that stimulant medication may have a protective effect on the ADHD brain. Some studies suggest that untreated ADHD is linked with changes in brain structure and function over time. Things like having a smaller volume in certain areas related to attention and impulse control. When ADHD is treated effectively, including with stimulants, those differences often become less pronounced. So rather than harming the brain, medication may actually support healthier development and functioning. And there's another side to this. When ADHD goes untreated, people often experience more severe symptoms, more emotional stress and more difficulties in daily life, all of which can have their own long-term negative impacts on the brain structure itself. So to bring it all together, there's no scientific evidence that prescription stimulants cause brain damage. When used as directed, these medications are safe, even with long-term use. And importantly, they may help protect and normalise brain function in ADHD. Of course, medication isn't for everyone, and it's always a personal decision with your clinician. But if you've been avoiding treatment or trial of treatment because you're afraid of damaging your brain, the evidence should hopefully reassure you that this is not the case. If you found this helpful, please give it a like, share it with someone who might also need reassurance and benefit from the information, and subscribe for more ADHD focused content. Thanks for watching, and take care of your brain. It's doing the best for you.